Now, an executive council member of the Australian Nursing and Midwifery Federation here in Victoria has written in the nation's trade magazine, in the union's trade magazine, that the Cass review into gender affirming care is bogus. She claims it's not an example of robust or ethical research and it didn't have sound practices. It only included studies that were based on randomised control trials. What's your response to that, Rachel? Because again, Australia seems to be somewhat of an outlier here. We've had a dramatic change in policy in the UK, many parts of Europe, throughout Scandinavia, many parts of the US. But in Australia, we've ignored all that and we are going down this gender affirming care method without really much criticism or inquiry.
That's right. I mean, reading that article, it's just more activist talking points. We saw when the Cass review was first released that the activist lobby groups, the MPs who were on board, were scrambling to basically say that the review wasn't relevant, it wasn't done rigorously enough. Meanwhile, in the UK, after this 4-year systematic review by a highly esteemed paediatrician, they have now banned puberty blockers, except in the cases of clinical trials. That has also actually carried on over into the new Labor government, which was actually quite surprising because we weren't sure if Labor were going to be on board with this. But because the review, was so well done, they've actually said, well, no, we're going to continue with what the Tories are doing and we're going to actually put a permanent ban on puberty blockers. So all this is happening in the UK. Things like that are happening in other jurisdictions as well. Meanwhile, Australians still have their head in the sand, and you've got, again, these activist talking points being spouted out, in this case, by a union which is meant to be representing workers. I'm not quite sure why they felt the need to weigh in on this, but we're seeing it again and again and again. And until the MPs and the health practitioners start to listen to people other than the trans activists, we're going to continue going down this road, which is incredibly harmful, especially for children and young people.
Absolutely. And I know you've been calling for an inquiry locally so we can know precisely what's happening and what the outcomes have been here in Australia. Rachael Wong, thank you so much for your time this evening.